Good morning. Great. First, I want to say welcome, parents and caregivers. I know there are a lot of fantastic trainings for you to choose from. I appreciate you choosing to spend some of your Saturday morning with me. My name is Gillespie. I am a program specialist with the MCPS Autism unit. I am a special educator and a behavior analyst with well over 10 years of experience in the field of autism education, ABA. And today we are going to be discussing strategies to use in the home or skills you can target in the home setting with your child. I do want to let you all know that this content is geared for parents and caregivers who have children 12 years old and under. And just so you know, this presentation will be recorded, so we will have time for questions at the end, and please remain muted until then. Our training objectives for today is first, we are going to define cooperation. We will discuss noncompliance and what it is. We will review 10 different strategies or skills you can target in the home setting, and then we will do a wrap up and review. So first, what is cooperation? In the most basic essence, cooperation is the actions of someone doing what is helpful, wanted, or asked of them. And for most parents, that is the dream. You want your children to be cooperative. You want them to listen to you. You want them to do what is asked of them. And this is not just isolated to children with special needs. However, in special education, we often hear about noncompliance. And noncompliance is one of the most prevalent and pervasive problem behaviors in young children. Noncompliance is defined as the failure to follow a known instruction within a specific period of time. So we must ask ourselves, are these children being noncompliant, or do they not understand what is being asked of them? How do we know this? We know this based on that child's performance, based on data. Have we seen them follow this action or instruction before? Are they choosing not to respond, or do they simply not know how to do it? And this is a question we really have to ask ourselves more and more for those young learners, 3-year-olds, 4-year-olds, even up through elementary school. They might not actually know what you're asking, so we need to make sure, is this a skill deficit or is it truly noncompliance? And for caregivers, noncompliance can be frustrating, it can be debilitating, and it can be exhausting. And at some times, noncompliance can also be a safety concern in the home. But if you are here, you probably know this, and many of you attending this training may have experienced this. So what is our goal? Our goal is we want to increase cooperation and decrease noncompliance. And you'll be careful to notice I'm using the word cooperation. Why is that? Yes, many will say the goal is compliance. We want our children to comply. And the truth is that is correct. There are many situations where compliance is required. If your house is on fire and you need to get out, you need your child to comply and leave the house safely with you. Even in the morning, you need to get to work and go earn your paycheck. You need your child to get on the bus to go to school. You do need compliance at times. However, one of the reasons that I personally choose to use the word cooperation is because the term compliance has its pitfalls. With children become adults, those who are cognitively impacted, or those with disabilities, if they're drilled on being overly compliant at a young age, they could be taken advantage of later in life and later in adolescence or adulthood. So we do need to preserve some of those self-determination skills when they're a young learner. And think about for yourself, the times that you've been asked to do something and you were able to say no, or you were able to choose to do something differently. We enjoy that. We enjoy saying no sometimes. So that's why we want our children to learn to be cooperative, because yes, there are times we need them to do something in that moment, but for their lifelong goals, we also do understand that they should have some choice and dignity when choosing to do something and when to not do something. So when you focus on teaching cooperation, you are coming from a place of trust. There is no my way or the highway, but a mutual understanding in how to move forward and build skills. So going forward in this presentation, we are going to be discussing 10 different strategies. And when we review these strategies, we're coming from a lens of shaping behavior over time and skill building. There's no such thing as a quick fix. And if you push too much, you might lead to more explosive or unsafe behaviors. So shaping cooperation takes time over days, over weeks, and over months. And this is done with kindness and care. So the first strategy I would like to discuss is finding reinforcers and rewards. This is just as important in the home setting as it is in the school setting. What does your child like? What do they absolutely love? You should try to identify a bank of items that can be earned following an instruction. And it doesn't have to be a single small item. It can be an activity, it could be a thing, it could be a group of items, it could be a group of items and mom's undivided attention. It could be a full class of things that they want. And even when you think about what they want to earn, understand that for some children, the most valuable thing they might want to earn is going back to doing whatever they were doing before you told them to do something different. So if they were on the floor and they were listening to their iPad and they had their train set and maybe they were body rocking and you told them, oh, come here, take this. They just might want to go back to being on the floor with their iPad and their train set body rocking. That might be what their reward is. So it could be something you deliver to them or just allowing them access back to their previous activity. The next strategy is eliminating instructions when your child is engaged in play, when they're doing it their way. We want to observe them. We want to smile at them. We're going to comment on what they do, and we're going to engage with them if they initiate that bid for attention. We want to have safe times in the home setting where demands are not placed on them, but the parent or caregiver is there enjoying spending time with them. And we're going to avoid saying anything like, don't do that, try this instead. You're just going to show joy in what they are doing. And the reason why I'm saying this is because we don't want our children to associate when mom or dad or grandma or someone shows up in the room and that adult is there just to give instructions or just to disrupt the fun. We want that adult to be there and just be present and allowing them to be in their moment of their happy place, whatever it is. So that way you don't become a signal of doing something that is a little difficult or something that might be hard. This is a really big strategy, and I think we have to remember this, especially when we really want someone to comply with us. Begin with instruction you can follow through with. You can never make someone talk. You can never make someone eat. You can never make someone go to the bathroom and actually produce in the bathroom. These are things that ethically and reasonably you cannot make a person do. So if you're trying to build that cooperation and even teach skills in case they don't know how to do it at first, you should start with things that are motor-based. And when I say motor-based, I mean with our hands. So clean up. If they don't know how to do that, or if they're not being compliant and cooperative, you can physically guide them to clean up. Put in, you can guide them to put different things in. So that is one way to help build that cooperation early on. Write A. If they haven't demonstrated that task, or if they're not being cooperative to complete that task, you can guide them to do it. So these are skills that require some sort of shaping. And for the other things, again, you cannot force them to talk. So you can't force a child to go say, oh, tell your sister you're sorry. You can't make them do that. That's only going to build frustration for you as a caregiver, and you can't produce that outcome. So really just follow through with those instructions that are motor based at first, and you'll get some traction there. Our fourth strategy, provide as many choices as possible throughout the day. I want you to satiate your children on choice. What shirt do you want to wear? What snack do you want in your lunchbox? What chair do you want to sit in at dinner? What order do you want to complete your nighttime routine or your chore routine in? It does not matter if your child is vocal verbal, if they are just using gestures, if they're using sign or pictures to communicate. You should still be giving them choice throughout the day, and this will empower them and give them items they can control. You can give them an array of choices. If your child isn't yet speaking, but they are, gesturing towards things, you can still lay out 2 options of a shirt and say, which one? And just see what they gravitate to. That way you're empowering them. When we talk about kids with special needs, think about all of the times that they don't have a choice. They might be falling around school with an adult all day. You're constantly helping them, maybe for safety reasons or because they haven't developed certain skills yet. So we really want to give them as many choices as possible. And this can help with that non-compliance. If they're given choices, then it's not necessarily a demand, but they're part of that decision-making process. And again, that can start as early as 3 years old. Get that cooperation early and tell them, hey, you're part of this team. I trust your opinion. The 5th strategy, be clear and concise with your directions. Don't be too wordy and don't be indirect. Don't go into a room and say, oh, I wish someone would help me clean up, or I wish the TV wasn't on so loud. That abstract language isn't going to help with understanding. And again, it can lead to frustration for you as a caregiver, and the child isn't going to understand what direction you're asking of them. Be direct. Katie, clean up your Legos. Or Katie, put Legos in bin. Provide the materials for them. Show them what you're asking. And you know your children best. Each child is different and each child is in a different place. So does your child know 1-step directions? Do they know 2-step directions? See what they've already demonstrated at home and start there. If you give multi-step directions, like it's time to clean up, we have to come to the kitchen and sit down for dinner, they're going to get lost in that 3-step sequence. So break it down based on what they've demonstrated at home. For 2-step directions, have they learned their colors or attributes yet? Really find those key points and cater your directions to them. Again, it's not non-compliance if they don't have the skill. Non-compliance is only if they haven't demonstrated that skill in the past and they're refusing to do it. So this is a very important one. This is a strategy and a skill that you might have to build at home. Call your child's name prior to the direction you give and wait for them to acknowledge you as the speaker. That is a strategy to help with cooperation and compliance, but it's also a skill you might have to teach. Respond to name is one of the most pivotal early learner skills for any child. You call their name, and do they pause and look up to you? That is what we call a cusp skill, where it leads to other skills down the road. And it's also important that they learn this skill across lots of environments and across busy times and not busy times. So if you have a child and you're in their IEP meeting and they're working on respond to name, don't assume that because they've mastered it at school, that they've also mastered it at home. That's when we talk about generalizing skills. When we talk about generalizing, that means that your child has demonstrated mastery across many different environments, and they can do the skill across all of those environments. So first, see, can your child respond to their name? Do they look up at you? Do they pause what they're doing for even a split second? If they can do that skill, then before you give directions in the future, call their name. Juan, stand up. He looks up at you and then he hears the direction. You're gaining their attention first. If they haven't yet demonstrated the skill of respond to name, target that at home. Bonus points if you have a learner who has some vocal ability and can respond to their name with yes. You say their name, Juan, and they look at you, yes. That means that they're listening and you have gained their attention, and you'll be more successful with delivering directions following it. So it is a really important skill to teach, and communicate with your IEP team if you need help teaching that skill. So when they do have that skill, you are setting the expectation for that child to look towards the speaker and wait for the next instruction. But you also want to call your child's name, not just when you're telling them to do something, especially if that something is a non-preferred activity. You also want to call your child's name before giving them compliments, before giving them snacks and fun things. Again, like we spoke about earlier, you want your presence in your child's life to not signal, I'm here to tell you what to do or to give you a demand. You're setting that expectation that sometimes as a caregiver, I'm around and we're just doing fun things together. And other times I'm going to give you an instruction. So you might at times say, Juan, stand up. And other times you might say, Juan, hi, you're doing great. And just giving a compliment. So that way, again, your child isn't going to be like, ooh, my mom and dad are calling me. I have to do something unpreferred right now. It's that balance of both to really help increase cooperation down the line. So our 7th strategy is moving towards them and being in close proximity when you give that instruction. And this ties back into what we just talked about of calling their name first. Think about the times that you've been at home and your partner or your husband and wife calls you from 3 rooms away and you faintly hear and you're like, how do they expect me to listen to them right now? Move towards your child, get close proximity to them, and then call their name. And that way too, if they don't respond in your direction and look at you, you can give them a little shoulder tap and have them look up. That way, again, you are gaining their attention to have more success when you give whatever direction you need to do. You avoid having to repeat yourself because that helps in the learning process, giving directions once and then moving into teaching. And always give that little compliment before the demand. Wow, you did a nice job looking at me. Let's do this, and give that clear and concise instruction. Remember, your child may still be learning certain directions or routines, so you want the first time you say something to have meaning. And if they don't know how to do it, we prompt. Do that gaining attention on the shoulder if they're not listening, and really reinforce with those rewards that we talked about earlier. And again, this ties nicely into what we just talked about. We're delivering instructions using 3-step prompting: tell, show, and help. This is also similar to a lot of models of instruction in the classroom, so your child will be familiar with this. Tell, you have your child's attention, you called their name first. Katie, they look up at you. Wow, I love how you looked. Or what a beautiful smile. Pick up your toy. You gave them that compliment, you gained their attention. And did they do it? Did they pick up that toy? Great, you picked up your toy, nice job. Okay, go back and do whatever you were just doing. You do it again. They did not comply. They did not pick up that toy. So instead, you wait, you give that clear and concise instruction again, pick up toy, and you model it for them. You're showing them the expectation. Remember, we don't always know if the child has demonstrated this direction to mastery across multiple settings. So you're showing, you're picking up the toy, pick up toy. Did they do it? You praise them. And if they don't do it again, after you're modeling for them and you're showing them, that's when, because it is a motor task and you can help guide them, you repeat the instruction, very clear and concise, and you physically guide them to complete it. So you can use hand over hand, hand under hand, and you really want to use the least physical guidance needed. Some students, some children might just need a little guide at the lower arm, maybe a shoulder tap, and then fading that out. And when you do have to physically help them, that's when you give a more neutral tone of voice for their cooperation. So you just say, that's doing it, and you move along. We want that exciting praise to be more when they're demonstrating independence with a task, whether that is the first time or with modeling. Provide authentic praise and acknowledgement of cooperation. You really need to be specific and celebrate the cooperation. What did you ask of them? And give that specific verbal praise and that reward afterwards. Clean up toys. Yay, you cleaned up your toys. You're giving specific praise. That's also going to reinforce that understanding that they complied with the direction you gave. They're building that skill. Up the reward for hard stuff. At the start of this training, we discussed that sometimes kids don't want a single item to earn. They might just want to go back to what they were previously doing. So if it was a hard task and it was really unpreferred, and you know every night, they do not like this shower routine, give them a bunch of good stuff afterwards. Make it so they learn over time, because again, we're shaping cooperation over time. I'm going to do these hard things and I get good stuff afterwards. And then the more they learn that routine, that sequence, over time, again, days, weeks, months, you're shaping that cooperation, you will be more successful down the line. You can also reinforce your child by helping. Think of how overwhelming it might be if there is a bin of all of these train pieces on the ground and you say, clean it up. And it is 50 train pieces and blocks and train tracks. And they go and they start picking it up, but that's going to take them 10, 15 minutes. And you know what? They're doing it, but I also know that's hard for them. Again, celebrate, be specific. I love how you're cleaning up your trains. I'm going to help you, and do it with them. Then again, as the caregiver and the parent, you're not just this person coming in and giving demands and being the person that just points and tells. You're being the person that's there, supportive and cooperating with them and showing them, hey, when you do something my way, I'm also going to help you. It's not so hard. And that's a really nice way to do things. So if your child begins to engage in some minor behaviors, and when I say minor behaviors, you tell them to do something and they might start to whine, or maybe they clench up and you can tell they're a little agitated at you. Maybe your child has some sort of self-injury where they, clench their fists and give a little chin hit. It's okay to acknowledge their feelings. It's okay to say, hey, buddy, I know this is hard. I know this is, not what you want to do. And then lessen that demand to get to reinforcement quickly. So again, let's look at that big bucket of trains. You have the pieces everywhere. You told them, hey, it's time to clean up. They pick up 2 pieces and they give a little grunt and a whine. I know this is hard. You're doing a great job cleaning up. You're acknowledging their feelings and you're giving specific praise. They get a little bit more whiny and you go to help them. And then you're still looking at this really large pile of trains. You could say, hey, you know what? You did a nice job cleaning up those 6 pieces. Why don't you play for a few more minutes? And then in a few more minutes, give the instruction again. You're going to reinforce them by allowing them to go back to engaging with those previous items. Again, we want to build this cooperation over time. So there is no quick fix, and you're building trust when you work with your child on these little building blocks and steps. And you're building that trusting relationship. So it's okay to continue with the demand, even if they're showing discomfort, have a little bit of that follow through, but get to the good stuff. You really want to move up in your instruction so that way they understand that hard things in life happen, but then good things can happen after. And you don't want to avoid the hard stuff because hard stuff, again, it happens for everyone and they need to get used to that. But we're going to do it bit by bit. These are young kids, right? 3 to 12. They need to learn these skills and practice them and do it across different environments. Okay, so I want to review some of the key points we've been discussing. You will have more success with dealing with noncompliance if you target skill building and shape behavior. And noncompliance is only noncompliance if they've demonstrated that skill multiple times across multiple settings. Your child is not being noncompliant if you've never seen them perform that task before. That means they don't have the skill yet. And although it can be frustrating, that is a teaching moment. It's a teaching moment at school and it's a teaching moment at home. And that's when we need to step in and we need to tell, we need to model, and then we need to help them complete it if they're still not doing it. Slow down your instruction. Really give concrete directions, models. With a lot of these early learners, when I'm giving one-step directions, I like to do a gesture to pair, so that way it helps bridge that understanding. When I say stand up, I might say stand up with my hand lifting, so they can see a gesture and kind of understand, oh, okay, I need to go up. Or get pen, and I point to a pen. Any little thing like that with those clear, concise directions can help your child be more successful and to learn those skills. And you really always need to reinforce the good stuff. You want to reinforce that cooperation. You want to give them compliments. You want to be in the room when they're playing and not interrupt their play. You don't want to get into their items if they're lining up their animal toys in a certain way and, not really playing with them, but they're just being routine. They're lining them up. You don't want to interrupt that and say, hey, do this instead. You just want to smile at them and say, wow, this is cool. Thanks for letting me hang out with you, because you want your presence there to not always be about giving instructions. You want your presence to be both, sometimes I give instructions, and sometimes I'm just here having fun and watching you be in a happy place. Okay. So I know I've been giving a lot of information, and I know some people did join a bit late. So I'm happy to take any questions as well. And then if there are no questions, there is a survey I will put in the chat. A lot of the information I presented today was based off of a few different articles that are listed here. And as I do work for the autism unit for MCPS, we do have a lot of resources available on our website if anyone would like to note that information. Any questions?